Hello, good morning, my dear friends. So, today I'm again back with a small little information. So, as I told you, that 14th Feb was the diagnosis of my cancer when I actually knew that cancer is there in my body, and the things went very quick in my case. And then 16th was the first day of my chemotherapy. I was supposed to have the chemotherapy then. So, in our minds, we're very clear कि हम hospital जाएंगे, intravenous cannula लगेगा, and chemotherapy हो जाएगी. But to my surprise, there are many different forms of giving the medicine into your body. So, one is the simple, which you say is the cannula, in which every time you get pricked and you get a cannula done and you take your chemotherapy, and that's it. But the another process which is there is PICC line, which is known as peripherally inserted central catheter, in which a very soft, flexible, hollow kind of a tube it is inserted into the large vein of the arm, and which is just above it is very near to the heart and is above the bend of the elbow. And to keep there are clamps which will always keep hanging out of them. That is, and you can close the clamps when they are not in use. So in case you have to get any blood test done, अगर आपको कोई भी blood test कराना है, कुछ भी कराना है, तो आपको हर बार अपने आप को प्रिक करा के प्रिक नहीं करना पड़ेगा. आप उसी में से ब्लड सैंपल्स ले सकते हो और कीमोथेरेपी. Hi, beautiful folks. So, as I was discussing, that there are different ways of giving you the medicine inside the body. So, as I discussed, one is the PICC line. The other one is a chemoport. A chemoport is an implantable device which is basically put in the upper chest area, and it is not visible. It is, of course, a surgical procedure where you will have a few stitches, but it is like you can be out of the hospital in a day after getting your chemoport inserted. It is an implantable device in which they put the device, and every time when they have to take out the blood samples and all, you are not supposed to get pricked, so they can take it out directly from the chemoport, and similarly they can give you medicine through the chemoport. These are the two different ways, the pictures of which I'm going to attach, and you can watch in this video, and then you can take a decision that what you want to do. Both the chemoport and the PICC line, you need to take a bit of precaution that you have to, there is a scope of infection. Now with the technology, advancement in the technology, it is quite reduced, but it is there. For the PICC line, you have to go to the hospital and get it flushed, and same goes for your chemoport. So I'll tell you in my case, I did not get any chemoport or PICC line inserted inside me, because I was having a scare. And secondly, what was the thing in my case, that I didn't want my daughter, to get scared, because I personally don't like those clamps hanging, because then everybody would, bounce into me and ask me what's wrong, because that's so obvious. Even if you put the sleeve in India, I mean northern India, it's like too hot. I cannot wear that sleeves in the month of June, July. You may say I can comfortably wear it till March, but post that I cannot, and I didn't want that thing clamps to kind of keep on hanging. And because there's a scope, or my child was like just 5 years old then, and then it might get I don't know, I was like little scared about it, so I didn't get it done. And same goes for the chemoport. I didn't even get a chemoport done, though the option of chemoport was not given to me at all. This I got to know after my treatment was started. Probably if I would have known prior about the chemoport thing, I would have definitely try to go in for that, because you go hands free whenever you have to go. You don't have to sit with your arm blocked all the time, so you're hands free when you have the chemoport, and it is kind of comfortable. It is not visible and all that stuff. But in my case, I wasn't told. So this video is to just tell you that please, you can ask your doctor, you can talk to your doctor, you can choose the way you want to take. I have been taking it intravenous, and you had been seeing, my arm is mostly all the pricks, because before I go for my targeted therapy, I have to get my blood investigations done. Every 21 days, I have to get a blood investigation done, and I always get myself pricked. Probably I have that willpower and I can tolerate that kind of pain, or probably my body has got used to that kind of a pain, because I didn't want any foreign thing inside my body. That's my personal take. I'm no one to guide you about it, but personally, I don't like it. Any foreign thing inside my body. So I chosen for getting my intravenous through the cannulas directly. Every time I go, they prick me. They put the cannula. I take the medicine and get back home. So, I'm like little. I don't have any tension of getting it flushed every week or but definitely the veins go very weak with the kind of intravenous cannula which I put. Probably it gets really, I'm sorry, the veins really get little weak because of so much of chemotherapy. The sometimes it even happens that the vein of your arms, they go totally black in some cases. God has been very kind to me. Now the veins have been very weak in my case too, because every time when they have to put I have to take a targeted therapy, it's really a struggle finding a vein for me. But God has been kind. I've been getting such good medical help. That's a divine blessing and blessings of my Guruji always, that it is going. So I'm just managing it with that. But in your case, I would please request you to choose the option between a PICC line or a chemo port or an intravenous before you start off with your therapy. I was not aware about the chemo port thing. Probably if I was told about the chemo port, I would have definitely gone in for that. So this video is again for your information. Please try to spread it. Try to give this information to as many people as you can, because these are small little things, which I have learned from my previous experiences. And bye for now. I'll see you soon. Bye-bye.